I'm Dr. N.K. Jankad. I'm an orthopedic surgeon. Welcome to Homeo Academy. Okay, today we are discussing the surgery. So the surgery starts from the swelling. What is the swelling? Swelling is a vague term which denote any enlargement or protuberance in the body. Means is your skin, then it's any protuberance from the skin. This is a swelling. As per cause, it may be four type mostly, like a congenital swelling, maybe inflammatory swelling, maybe traumatic swelling, or maybe neoplastic swelling. So we will discuss one by one. First is congenital swelling. Congenital, as the name denote, it presents since birth, or may make their appearance later in life, but they are present since birth. So since birth, which swelling present and appear since birth, there are mainly three types, like hemangioma, cystic hygroma, and meningocele. You can remember the mnemonic MCH, Mother and Child Hospital. The appears later in life are the brachial cyst, dermoid cyst, and thyroglossal cyst. You can put them in bracket. Which appear later is the brachial cyst, dermoid cyst, and thyroglossal cyst. So we'll discuss the hemangioma. Hem means blood, angio means blood vessels, oma is the tumor suffix, but it's not a true tumor. They are vascular actually malformations. Or hamartomas. What is hamartoma means? Your normal body tissue present at the abnormal site is a hamartoma. It arises from blood vessels. Blood vessels can be capillaries, then it causes capillary hamartoma or hemangioma. It's arises from vein, then called cavernous. Cavernous means vein. Artery, then it's called a plexiform or chircoid hamartoma. So what are the capillary hamartomas or hemangiomas? Capillary hemangiomas, they are flat, not much raised above the skin. Actually, capillaries are tiny blood vessels. They don't have so much pressure in them. So they are the group of capillaries cause a minimal swelling above the skin. But when you press them, they can get pressed easily. Capillaries have arterial blood, so they appear bright red or purple patch. Pressure causes complete disappearance of the color and return when the pressure is removed, like your fingertip. Examples of capillaries hemangiomas are port wine stain, nevus flammeus, which presents since birth and persists throughout life. Salmon's patch, which appears on the forehead or occiput and disappear by 1 year. This is important question. Spider nevus, which appear on upper half of the trunk on the manubrium sterni, often multiple. They are non-tender. Mostly the questions comes with the liver disease, liver cirrhosis, liver tumor, or tumor producing osteogen causes spider nevus. You need to remember the other signs of liver cirrhosis also. Then vein rose patch, Campbell-Morgan spot, strawberry angiomas, which appears on birth and spontaneously regress after few months or years. Sturge-Weber syndrome, it's a capillary or cavernous hemangioma over the face and ipsilateral cerebral hemisphere. It comes with the history of a focal seizure. So this is the important history. And the important X-ray finding is tram, track, or railroad calcifications. Cavernous hemangioma. Cavernous means veins. Veins are larger in diameter, but pressure is also lower than the capillary also. So they are bigger, they are softer, compressible, but reappear on the release of pressure, same as capillary. Commonly seen on face, lips, cheeks, and the brains. Plexiform hemangioma is a network of dilated interwoven arteries, like bag of earth form. Bag of earth form means in the arteries the blood flow with the pressure, and when you put the hand over the hemangioma, you will feel the blood is moving. It's like a bag of earth form. Circoid aneurysm, they are the pulsating swelling. These are the bigger arteries, so you will feel the pulsation in the tumor. So what is glomus tumor? Glomus tumor is seen that what is the smooth, heavy communications and the nerves. So let's see what is it. So glomus tumor or also known as glomerulonephritis. They are specialized AV communications, arteriovenous communications, surrounded by smooth muscle cells, large epithelial and cuboidal cells. Origin is mesodermal. The sensory nerves of these epithelial cells make it very painful. This is the sensory. Okay, it's very painful. Most common site is beneath the nail under the fingertips. So we used to remove, I have removed almost 3-4 glomangiomas in last short period of time. They do not blench on pressure. The benign tumor never turns malignant. It's always benign. It's never turns into the malignant. It's important questions. It is an angiomyoneuroma because of component. It had blood vessels, so it's angioma. This has muscle cells, so myoma, and nerves, so it's a neuroma. It's an angiomyoneuroma. Now look back to the slide. You can see these are the arteries, this is the vein, there's the smooth muscles fibers, these are the smooth muscles fibers and nerves. So because of these nerves they are so many painful. Normally benign tumors or simple tumors are not painful, but glomus tumor is very painful and the patient always say just remove it. Now the cystic hygroma, it's most common form of lymphangioma, lymphatic vessels, made up lymphatic vessels. A localized cluster of dilated lymph sacs in the skin and subcutaneous tissue that connect to normal lymph system and hence grow into lymphangioma. They are the same like capillaries, veins, they are capillary hemangiomas. It's a lymphangioma, means made of lymphatic vessels. It exhibits a large cyst-like cavity containing clear watery fluid. Lymph is always a clear and watery fluid or a straw-colored fluid containing the cholesterol crystals and lymphocyte. 75% most common location is neck, lower third of the neck. This is also called as hydrocele of the neck. Mainly hydroceles occur in the testis, scrotum. It's also called as hydrocele of the neck, associated with Turner syndrome. Okay. Cystic compressible translucent swelling in the posterior triangle of the neck, mostly lower third. One of the earliest tumor to appear after birth. This is the important question. So transilluminating because the fluid is clear, and it's non-pulsatile because lymph doesn't flow with the pressure. Clinical feature of lymphangioma is painless but may become painful if infected. This is a soft swelling, same like others, nothing new. Painless, soft, fluctuation present, translucency present, and partially compressible as fluid present inside. So it's not completely compressible but partially compressible. So let's look at the picture. So these are the lymph nodes. These are the lymph nodes. Lymph nodes connect with the cisterna chyli, and there are the channels. So around the neck it get collected and form a tumor-like conditions. It's known as cystic hygroma. Brachial cyst and brachial fistula. So it is situated in the upper part of the neck with its posterior half lying under cover of the upper third of the sternocleidomastoid muscle. It arises from the vestigial remnant of the second brachial cleft. This is the important question, you need to remember it. It arises from the vestigial remnant of the second brachial cleft, lined by squamous epithelium, contain either clear fluid or toothpaste-like material. When clear fluid is present, the fluctuation will be there, transillumination will be there, same as cystic hygroma. So you can say this is the sternocleidomastoid muscle, this is SCM, this is the brachial fistula, and this is above the brachial cyst. need to remember the relation with the muscle. Brachial fistula is always have external orifice. Fistula words meaning which connect the two epithelially lined lumen. So the external orifice is situated to the lower third of the neck near the anterior border of the sternocleidomastoid, and internal orifice is anterior aspect of the posterior pillar of the pharynx just behind the tonsil. So it connect, fistula always get connect either skin to lumen or lumen to lumen, you can say. And the sinus is always a blind sac which connect the don't connect, it arises from the skin and it's a blind sac. This is the sinus and the fistula. Cyst. Dermoid cyst or sequestration dermoid. Most common location is outer angle of the orbit. It develops in the line of the embryonic fusions. Okay. So the cyst may appear anywhere where the two embryonic process meets. It contains pultaceous materials, fluctuations not too good, but you can feel the fluctuations sometime, but translucence is absent because it's not a clear, it's like a toothpaste like material, you can say, pultaceous, semi-solid, semi-liquid type of things. It's round, smooth and will yield to pressure. Thyroglossal cyst. It's a cyst of thyroglossal tract, hence mainly midline in the structure. It's a painless swelling. Most common position in subhyoid, just below the hyoid bone. Second common position is suprahyoid, either below hyoid or second is above the hyoid, closely associated with hyoid bone. Fluctuation is absent because the cyst is too small and the content is too tight. It's like you feel like a solid thing. Swelling move up on the swallowing and move upward when the tongue is protruded because it is connected. So whenever tongue goes out, it goes up. So we have discussed the congenital swellings. Now inflammatory swellings. First is erysipelas. The skin and subcutaneous tissue is involved. It's a spreading cuticular lymphangitis that may follow even a scratch. Most common organism is Streptococcus pyogenes or Hemolyticus. Group A, raised rash of the erysipelas have a sharply raised margins. It's also called as million's ear sign. Erysipelas spread into the pinna, but cellulitis cannot. Okay, so this is the most differentiating feature of the cellulitis and the erysipelas. What is cellulitis? It's inflammation. Itis means inflammation. Cellulitis is spread along the subcutaneous or facial plane. Most common organism of cellulitis is Streptococcus pyogenes. It can cause septicemia when the content of the abscess goes into the bloodstream, cause septicemia. Initially red, itchy at the site of inoculation, and may progress to gangrene later on when the supply of that particular tissue, oxygen supply and nutritional supplies get disconnected, then it causes gangrene. What is Ludwig angina? It's a cellulitis at the submaxillary region, then it's called as Ludwig angina. What is boil or furuncle? It's an infected hair follicle. Most common Staph aureus. What is carbuncle? It's an infective gangrene of subcutaneous tissue. Staph aureus most common cause, mostly seen in diabetics, male above 40 years. At the nape of the neck is the most common location. Sieve like cribiform appearance is seen and discharge come out through the several openings. It's the characteristic of the carbuncle. Usually discharge come from one or two opening, but the several opening cause discharge in the carbuncle. Now the neoplastic swellings, or you can say tumorous. Neo means new, plasm is a tissue. It's a growth of new cells which proliferate independent of the need of the body. Means body doesn't need that cells, but it grows. While benign tumor proliferate slowly with little evidence of mitosis and invasion of the surrounding tissue. And malignant tumor proliferate fast and with invasion and the mitosis. These are the three important difference between benign and malignant, because tumors can be benign and malignant only. Okay, so benign are the slowly proliferated, little evidence of mitosis and no invasiveness. Opposite is malignant. So you need to remember the difference in the benign and malignant tumors. Benign usually seen at the younger age, malignant seen in the later, but may in the younger age. Durations, they are slow growing, so years of duration, rapid growing, like a month of growing, almost 6 months is also short duration. Okay, pain usually absent in the benign, and in malignant they usually present at the later stage, but in osteosarcoma it starts from the beginnings. First the pain occurs. Weight loss never seen in the benign, is always seen in the malignant tumor. Loss of function usually not seen. This is seen quite early in the malignant tumors. The person cannot use his limb. So clinical difference in the benign and malignant are the sign of cachexia, anemia, weight loss, not seen in benign, they are seen in malignant. Benigns are freely mobile, smoothly surfaced, margins are definite and smooth, their consistency is usually firm, the pressure effect usually absent, regional lymph node are not enlarged, distance metastasis is never. They are all seen in the malignant, like they are fixed, not mobile, margins are usually irregular, not definite, surface is irregular, consistency mostly hard or very varying, like here it is soft and nearby tissues hard. Pressure effect usually present in the surrounding tissues, like when it occurs around the neck region, then it can compress the esophagus, trachea, abdomen, it can compress the intestine. Okay, lymph node early involvement is seen and lymph node are enlarged, and metastasis is the feature of malignant growth. Secondary changes not seen in benign tumors, often seen in the malignant. Recurrence never occurs in the benign and it often occurs in the malignant. On the basis of histology, cell differentiation is a feature of benign growth. Means you can differentiate the cell of proper benign tumors and normal body cells. They are undifferentiated cells in the malignant. Polarity, cells are arranged in as parent tissue on the polarity. The polarity is lost in the malignant. Capsules is always present in benign tumor, or no capsule formation seen on the malignant. Anaplasia not seen in the benign. Anaplasia is a feature of malignant growth. Nuclear structure same as the parent tissue without mitosis, and the nucleus become large, hyperchromatic in the mitosis. They are the histological difference. So you need to go through it. They're easy. You need to remember. First, as a symptom, what the difference in the symptom of benign and malignant, what's the difference in the signs of malignant and benign. On the investigation, what's the difference in the histological investigation of benign and malignant tumor. So how is malignant transformation of a benign tumor recognized? Sometimes benign tumor can convert into the malignant tumor. So how you identify? So like a patient has long history of a small tumor, and now the size is increased in few months, sudden increase in size, then increase in the vascularity of the tumor, it got warmth. Fixity of the tumor, like first the tumor was mobile, freely mobile, now it gets fixed in the surrounding tissue. Secondary changes like pigmentation occur, the skin ulceration, bleeding occurs. Appearance of pain, you see benigns are painless. Appearance of pain cause conversion of the benign tumor to malignant, involvement of the regional lymph nodes, and appearance of the distance metastasis. Okay, so we are discuss neoplastic swellings. First, benign neoplasm examples are like lipoma. Lipoma are a cluster of fat cells which become overactive and so distended with fat. It's the most common tumor of the subcutaneous tissue. Every third, fourth person can get lipoma. It's a universal tumor because it may occur anywhere in the body. Type: encapsulated, diffuse, or multiple. Most common is encapsulated, like a single lipoma occurs. Sometimes diffuse lipoma, you cannot identify the margins. It's known as pseudolipoma. And multiple lipomatosis. Some patients have multiple lipomas everywhere in the body: hands, forearm, legs. Encapsulated means lipoma surrounded by a capsule, a fibrous structure. It's a capsule. Then it's an encapsulated lipoma. So encapsulated is most common variety. The fat cells arranged in the lobules, separated by fibrous septa, enclosed in delicate capsules, may attain a very big size, or usually they are small, around 3 centimeter to 4-5 centimeters. Occur at any age, but may seen in the children. Painless, lobulated, they are soft. Okay, anywhere is the site. Overlying skin is normal in colors. It's a slip sign is important sign of lipoma. The edges is definite and slip under the palpating finger.